This has been a subject of interest for me way before I got to the U.S. Senate. When you're talking about diabetes, drugs, prevention, remediation, I wrestled with it to where I was at the point of frustration. There was nothing that you couldn't generally solve in running a business other than health care, which generally ended up how lucky you were that it was only going up 5 to 10% each year. So when we were at the point where I could really do something about it, large enough to self-insure, did three simple things. Number one, I realized none of my employees were healthcare consumers. They were the inelastic demanders of remediation, generally wanting the plan to pay for everything. And in the same way, if your private plan doesn't pay for it, people look to government to do it. It's created a system that has given us a bizarre kind of cross-purpose where it doesn't jibe with what works in most other markets. What I did, they became healthcare consumers. I gave them every wellness tool, including a free biometric screening. I didn't coddle them. You were going to pay more if you wouldn't take that. And you know what it's done? It has lowered healthcare costs. We've been doing that 15 years and have not had a premium increase. Unlike Dr. Lipska and maybe Dr. Kowalski, how much of what we're talking about here is part of a broken system that is now driven mostly by huge hospitals that love opaqueness, no transparency, and insurance companies that have gone way beyond indemnification to where they're in on everything and they grab roughly 15% of the healthcare dollar that's purely administrative. We're talking about things, I think, on the side of how you fix diabetes and other chronic ailments. What about fixing the system itself? I'd love for you, Dr. Lipska, to weigh in, and then Dr. Kowalski.
Thank you for that question. I agree with you that our system is broken. In terms of, how do we fix this for diabetes in particular, to prevent diabetes, to prevent obesity? I think the healthcare system needs to serve the needs of the patients who develop these conditions, but I think we have to, again, go upstream from the healthcare system in order to prevent people from getting sick in the first place. And I think that's critical. That's going to save us money and, in the long run, to keep people healthy. And I think that's upstream from the healthcare system.
So I'll just make a quick statement because I'm going to come in with a research perspective, but start by saying, we're talking a lot about obesity and diet, that being obese does not mean you're going to get diabetes. And sometimes I worry we stigmatize people with type 2 diabetes by saying, and some of our colleagues said this, by you just stop eating and you'll get diabetes. This is a genetically inherited disease.
And I know that. I'm asking about the framework within which you'd like to see that would address it and many other things.
Absolutely. So when we think at JDRF, our mission statement is accelerating life-changing breakthroughs to cure, prevent, and better treat T1D and its complications. And I always take those words very literally and significantly, meaning your life's not changed if you don't have access to better care. And if the system provides barriers, as Senator Sanders said, to drugs that could improve your care and your life and your health, then we haven't succeeded in our mission.
And I'd agree with that. And I think that's a particularity that will weigh in to be helpful. Let me tell you what I think is a solution to this and the extremely high cost of health care, access, and all of it. And proud to say that later today, Senator Sanders and I will be introducing a bill called the Healthcare Price Transparency Act. I've been working on this for the 5 years I've been in the Senate, and I think it is the umbrella that finally takes us to solutions for this and many other things. Briefly, let me tell you what some of the things it's going to do. It's going to require machine-readable files of all negotiated rates and cash prices between plans and providers, not estimates. It's going to require pricing data standards, including all billing codes for services. It's going to require actual prices for 300 shoppable services with all services by 2025. It's going to require a testing by executives that all prices are accurate and complete. It's going to prevent preemption of state price transparency rules, codify the transparency coverage rule, and it's going to provide group health plans the right to access, audit, and review claims and counter data. Thank you, Senator Sanders and Senator Smith, for being on it. I hope to get all Republicans and Democrats on a bill that'll fix many aspects of health care.
Thank you, Senator Braun.